So our next speaker is Lisa Beck. She's an assistant professor of nursing here at Mayo Clinic, and she has a specialized interest in spinal cord injury. So she's going to share with us some of her thoughts about a wide range of issues that patients like our chordoma patients deal with. Thank you, Lisa.
Good afternoon now, and thank you for the invitation to share with you all. My specialty is truly spinal cord injury, but spinal cord injury is not just traumatic spinal cord injury. It's some of the complications with tumor burden in the sacral area within the spinal cord, around the spinal cord. So a lot of the symptomology that I see over the years are similar. So my disclosures, actually I have none, but some of the topics I'll talk about are a little bit more, might be a little more cumbersome for people to be freely asking questions of during this conversation. So if you have questions that you're not really comfortable announcing with the crowd, please feel free to write them on the card and send them, and Bree will pick them up. So that's my only disclosure. Again, I do work in the area of spinal cord injury, and the reason being is I'm really going to focus on more of the sacral area chordomas, because I do see a lot of those folks in physical medicine and rehab. Our team does, because we can add a lot to the quality of life. And Josh's slide earlier was like my intro slide to quality of life issues, looking at pain, bowel and bladder issues. In fact, your title was dissatisfying quality of life issues, and actually I call it a messy pain. And it works out pretty well. So really some of the bigger areas within Josh's slide were fit into this: mobility, emotion, skin issues, sexuality, bowel bladder management, and pain. So we'll kind of talk through those things. So first of all, with mobility, a lot of folks will have some difficulty either with a little bit of weak plantar flexion, so being able to bend the foot down. How can we help manage that so you're not tripping, so you're actually walking appropriately, being safe on your feet? I know balance can be a problem. Certainly physical therapy can be of help to give you some guidelines and some strengthening activities that we can do, as well as finding the appropriate aids for your mobility, whether it be an AFO like the brace I have on the slide, a walker, strong arm canes, crutches, wheelchairs. Those are the things we can help you be successful back in your community. We want you to be out and about and in your community safe and successfully. And so our physical therapy team and occupational team can help with those kind of management things of, standing and working on balance, dynamic standing activities, standing at the sink and putting dishes up in the cupboard, working on balance, okay? Some people have poor proprioception, knowing where their feet are in space. How can we adapt and help you be safe? For example, one of my gals even just this week had a fall in her apartment because she was standing and putting on pants, and really does not have great proprioception, nor where her feet are in space. So it's just safety cues, such as maybe let's not stand to get dressed and put our feet into our pants, but maybe let's sit on the edge of the bed and then use something to hold on to get your britches up. Emotion's huge. You guys are, this group is going through a lot of different emotions. Not only are you dealing with a chordoma and all the effects of having the chordoma diagnosis, but those with physical attributes such as the spinal cord dysfunction that occurs, that even show up on prognosis as you're actually being worked up for your diagnosis. You're experiencing some of these issues, bowel and bladder issues, and these are spinal cord dysfunctions as well as a chordoma burden. And so you're kind of dealing with two diagnoses. The Chordoma Foundation is a great support for everyone. In fact, talking with Shannon, they're looking at having even more breakdown in individual levels of chordoma for discussion groups and peer mentorship, which I think is very valuable. In fact, I did look through the website and read many of the uncommon stories, And unfortunately, what I didn't see are some of the things we're really going to talk about are the non-transparent things that people don't see, but are really socially inhibiting folks in the community. And that would be bowel and bladder dysfunction, sexual health, some of the things that people are a little more uncomfortable talking about. And so we also need to voice these concerns and, how are we managing these issues and being successful at managing these and voicing our stories of how we can do this. Because if we hide those stories, it feels like, well, then they're inappropriate things to share and to talk about. And really, these are things you need to talk along with each other as peer mentors, along with your healthcare providers throughout your journey. Certainly, some of the folks with sacral area chordomas may have a little dysfunction in their skin sensation, especially in the buttock region and perineal region. And I have lots of folks that can't sense when they've sat too long, or maybe have neuropathic pain and pain uncomfortable sitting so long. And what can we do to help with that? So if you sat too long and you don't have that, what I call bleacher butt sensation that's told you sat too long and you're moving about in your chair, just being able to take a mirror and look behind there, making sure you're keeping your skin healthy and intact. Protection. I do have some folks, we work on getting these black Rojo cushions. It allows some pressure relief sitting on different surfaces. And I have guys that will carry this throughout the clinic when they come to visit. They'll carry it just like a satchel because it actually offloads and helps prevent pressure to their sacral area and provides them comfort in sitting. In fact, one of my gentlemen has actually resumed to riding horse again because we were able to allow him a little more pressure relief with a cushion. Also, just being careful, so protecting, especially when you can't feel hot, cold, heat pads. Be very careful with heating pads. I've had folks burn themselves with heating pads because they don't have that protective sensation if it's too hot. Heated car seats. So just being very careful. And then if you did have a sacral flap procedure done of any sort, sometimes it's a little more difficult in healing these flaps in the skin tissue, especially after radiation. So it's just, being patient and really protecting that flap area, the incisional area. We work very closely with Dr. Yuzemski and his crew and making sure we're protecting those and helping people go from lying to sitting without putting stress onto those incisions too. Sexual health. This is one of the areas that I do a lot of conversation and counseling with my patients, no matter where their level of spinal cord dysfunction is. And, it's such an important part of health care and how we feel about ourselves. So sexuality certainly is somewhat changed as people undergo stress, new diagnoses, new functional impairments. And so how we convey ourselves as a female, as a male, who you are, now that's sexuality. It's how you dress, it's who you go and spend your time with, it's where you go and out with your friends. And that might change, but you need to find again, who are you again, and reclaim that sexuality of you. Sex drive certainly can be altered, especially with a new diagnosis and a lifelong journey of some kind of functional impairments. And really this can be changed maybe and really the sex drive is really hormonal and nerve driven. So certainly when people are ill and not feeling well, or some of the pain or some of the medications, some of these are impaired. And then sexual activity itself. So sacral burden tumors sometimes will have folks, as I said, the impaired sensation of the buttock region and the groin region kind of gives me a little heads up that there might be some difficulty with sexual activity itself. For example, men may have some difficulty obtaining erection. Women may have a difficulty with orgasm or even just feeling stimulation. And so working with your healthcare providers on what can we do differently within our own relationships to reestablish our sexual health, our sexualness, and our sexual activity. So reestablishing intimacy and sexual activity is huge. And I've spent many visits with some of my folks that had chordomas or sarcomas. And it's really starting slow. It's having that conversation with your significant other, but also being comfortable to talk about it with your healthcare provider. And those of us that are healthcare providers in the room, we also have to ask the question, how are things going regarding sexual health? Because if we don't ask the question, then it feels like it's an inappropriate conversation to have. And same thing, and we talked, Shannon and I talked, having those conversations even on the website of, here's some of the things that some of the untold stories are available, to make it is an appropriate conversation to have with peer mentors and with your medical health staff. So again, being able to express your thoughts and feelings with your partner, with your healthcare providers, how can they help you? Actively listening with your partner. Remember, intimacy is not just only intercourse. It's hugging, it's kissing, it's being with someone, it's enjoying the time together, it's cuddling, it's snuggling, and then so forth. So reestablish those relationships as you feel a little more comfortable in your own skin. Body mapping, especially those that have a little more impairment in their ability to feel within the perineal area. So I call it body mapping because you may actually find that you have new areas that you're a little more hypersensitive when being a little more sexually active. So maybe earlobes might be a little more engaging now, and you might find it a little more hyper engaging than it was in the past. And so being able to work with your partner, communicate, and try different things and try different positions, and you kind of have to be out of the box, but willing to try different things and communicate are probably the biggest two things I can say. Use all your senses. Hearing, listen to each other talking, maybe some light music. Seeing, thinking of images. Smell, some people have like lavender smells within the room that might be a little more enhancing. Taste, the old chocolate and strawberries might be a flavor for you. And really, again, it's being open-minded. But also, again, I just cannot encourage people more to have those discussions of what's going on and how can we as your providers help you move to the next step and feel more comfortable. Whether it's maybe it's trying Viagra for one of the men. Is it going to work or not? We don't know, but let's have that discussion. Let's try it and see what happens. Come back to clinic. Let's talk about it, okay? Bowel and bladder issues too are kind of those very social, important functions that we need to establish. And they're very frustrating because they can be out in the community and being worried, where's the next restroom? I have women that have to know exactly where the restrooms are before they go anywhere. They will leave their house, use a restroom, but make sure they know where the next restroom is. And so how do we help people manage both bowel and bladder? And especially if we're looking at sacral chordomas, we may note that people cannot feel the urge to void or the urge to defecate. They may not even know that they may have been incontinent of other. And so it's how do we manage so you can be, number one, successfully out in the community. And it's a consistent management. It's not letting your bowel and bladder manage you that you would stay at your house. It's let's manage those so you can get out and feel comfortable and confident. So starting with bladder management, usually we'll try and tell everybody kind of avoid the irritating fluids. Of course, we've got them all lined out in the corridor, right? So we've got our coffees, our teas, sodas. So water is your friend. Chocolate kind of can be an irritant as well, all those fun, good things, and alcohol. So avoid those irritants, and that'll be number one key. A bladder diary, I have some of my folks do a bladder diary, watching how much are you drinking right away in the morning, really how much coffee, and how much water. And if you look through the day, where are your influences at the end of the day? When are you voiding much more, and how can you shift your fluids a little bit different so you're not piling all during the day, or are you drinking all in the afternoon? Boy, at bedtime, you're not sleeping all night because you're up every 2 hours because you're in the bathroom. So it's helping people understand what their body pattern is and your fluid and input and output is. Again, some people may have a difficulty initiating a urine stream, knowing when their bladder's full. So or even having incontinence. So sometimes we'll simply start with a timed or avoiding schedule, which means going into the restroom every 2 hours and giving an attempt to void. And really what we're trying to do is give your bladder some capacity to hold urine, but also making sure you're emptying it at an appropriate time. We may do a double void, which means even sitting there after you voided, relax, maybe a little meditate, but also try and void again. Some people, it might be helpful just to give a little pressure over the bladder and bend forward. A little straining might help empty the bladder a little bit. And certainly, cathing is not a bad thing when we want to empty a bladder consistently and well. Because if we keep urine in a bladder for expended time frames and we don't empty very well, then you have a risk of urinary tract infections, which complicate things even more. So it's really learning how to manage and be successful. So even cathing, even if you empty your bladder with a catheter a couple of times a day, it's very well emptied. We lower that risk for urinary tract infections. So we do have options working with our physical medicine team and our urology team on how to best manage your bladder and keep you socially continent. Bowel management, a lot of times we can help folks manage their bowels simply by diet. And there's a lot of other options I have along the way. But bowel management, it's really, if you're on medications such as narcotics that are going to cause constipation, you might want to shift to the foods that are going to harden the stool a little bit, okay? Or not harden, but maybe stay away from these foods. However, if your bowel function is such that, boy, if my stools are really kind of soft and my sphincter is not holding stool back, I might want to tap into these foods that harden stool a little bit. Okay, so you can use your diet, your foods, to help alter your bowels and keep you continent in a sense. Again, on the opposite spectrum is the foods that soften stool. Here too, again, if you're on narcotics that are kind of constipating and you want to keep things soft and moving through the rectum and colon in a smooth manner versus having hard stools, yogurts with seeds, whole grains are friends. Vegetables and fruits are great for this. Of course, I like the chocolate component to it, so that works well for me. Other management besides the food, fluid is essential. And again, so when we talked back about the bladder, I've had folks that, I'm incontinent of urine, I'm just not going to drink very much, okay? So this also throws a problem. So if you limit your fluid intake, not only do you increase your risk for urinary tract infection, but here again, you can increase your risk for constipation because you need fluid to push to help your stool move down too. Staying active, getting up and moving about will help with peristalses. We do have medications that can help soften, harden, increase motility. Again, you can work with either physical medicine or your healthcare providers on which are going to be the best key elements for a bowel program for you. But you know what? You still have to be aware of what do these medications do. So if you're on a stool softener to keep things a little bit soft, but you have some kind of GI distress, you need to be able to know, oh boy, I need to not take the Colace for a while because I now have some kind of really bad loose stools going on and I don't need to contribute to it. So it's really knowing your medications and how they affect you and how to alter them accordingly. And then assisted elimination of stools. Some folks are unable to pass the stool through that sphincter. So we'll utilize either potentially a suppository or even just digital evacuation of the stool. And what we really do is try to develop a bowel program that's going to be consistent. So you can train your bowels. And some of my folks I do have on a daily bowel program with a suppository. And it's safe and it's efficient. And they're emptying the bowels right away every morning for the most part. And they're able to get out socially and not have to worry about being incontinent. So a bowel program is really a must for many people. Pain. Pain is an ongoing issue, and I saw that really spike. That was one of the high points in Josh's talk. For those with the sacral chordomas, pain is a lot within the feet area and the sacral area, the buttock saddle region. Again, I talked about using a cushion, a specialty cushion to offload. For some of the foot pain, I've been really been able to utilize some creams, and I'll show you some options that we use. But that neuropathic pain, people describe to me as like a shocking, burning, stabbing sensation. Kind of feels like the needles in the feet. And we'll try a variety of medications for this. Tricyclic antidepressants such as amitriptyline is kind of a go-to medication. It does help interfere with the nerve impulses of the pain sensation. You'll see us use anticonvulsants such as gabapentin and Lyrica, and they do stop some of those impulses. Honestly, I've worked with a lot of persons with neuropathic pain, and as a provider, this is probably one of the hardest things to treat. Are we going to obliterate the neuropathic pain? No, we can try and calm it down so that it's not noisy, so it doesn't wake you, so that you're able to get through your activities of daily living. Those are the things we can do. We want to keep you functional and keep you moving. Creams and gels. Capsaicin cream has been really a good product I've used on neuropathic foot pain, or at least on a localized area. That's been successful. You can buy that over counter, like at Walmart. Physical therapy, doing some activities, keeping you safe and upright and moving is helpful. Acupuncture, the TENS units may be of help. So again, here working with our physical medicine team, and completely distraction has been very helpful. I have a lady that has a lot of pain, but you know what? She just stays busy. She stays busy in her church. She's out walking. She's doing pool therapy. Those are the things that are helping distract her from what's going on in that pain, but also allowing her to live her life and move forward and face forward as best as possible. So I kind of stayed on time. So really some very just functional ideas and thoughts and considerations, but you do have healthcare providers within your, some of the bigger medical centers that can help you with these issues such as neuropathic pain, neurogenic bowel and bladder, insensate skin. And again, I can't really just encourage you to have the conversation about health, sexual health with your providers as well. So, all right. Yes. Capsaicin. Can you spell that? C-A-P. Spell me. You know, I have to write it down. C-A-P-S-A-I-C-I-N. Yes. It is over the counter, and then we can get higher percentage of the capsaicin. So capsaicin cream, the element that is really the functional element in that cream is cayenne pepper. And so it helps knock down that. It initially will give you a really bad burning sensation, but after a few trials or use of the product, it eventually knocks down that stimulation, and really 3 times a day, folks have been successful at utilizing that. You have to, and let me, word of caution, and I've done this, is after applying it, do not touch your, wash your hands and face. Don't go to the restroom or anything. First, wash your hands. So, yes. Yes, ma'am.
I just wanted to add to that. I'm not 100% sure, but I'm pretty sure that was the cream that my husband used. This is some years back, and it was on his back, and to relieve some pain there and so forth. And just as a caution for other people, we didn't realize at the time how much sensation was lost in that area, and he ended up burning his skin.
Yeah.
So just watch the direction and watch after if you're reddening up, maybe lighten up on the cream for a little bit.
Yeah, especially if your sensation's a little impaired there. Correct. Yes, ma'am.
I had a question. It is about sexual health, kind of. Do chordomas affect like pap smears, anything with, or when you have it removed, does that affect any kind of testing? I know, like pap smears and things like that. Are
I
those
wouldn't think
related?
it would affect pap smears. No.
Okay, just wondering.
Yeah. Yes, ma'am. Bree.
Any reports of success on the use of some of the medical marijuana?
You know what? And I did forget to ask or to add that to my slide. You're right.
Say the question again so everybody hears.
So the question was the effect and success of medical marijuana in the creams. And so as we are all here in Minnesota, we have approved use of medical marijuana throughout our system. I have not been a consenter for the use of medical marijuana, so I don't have a lot of resources and use of it, and I think it's still so new here in Minnesota that we don't have a lot of evidence behind the use and the efficacy of it. And really, honestly, I know our group that is our producer or the shop here in Rochester, I unfortunately don't have outcomes from them either. So if our patients are going to the shop to get their medical marijuana, we don't know their dose. We don't know what the titration is and the follow-up outcomes if they're changing dose. So there's still a lot of disconnect in that realm. So I think we have a lot to learn in the future in the utilization of medical marijuana.